Okay. All right. Hi, everyone. Welcome to this joint webinar between Tour for Diversity as well as the SH Prep program. Look, we're really excited to be here. I know that there's a ton of people out there. So far, we have 120 participants. It's doubling. As I'm talking right now, we're at 138, 149, 154. All of these people are jumping in. And I'm joined by a super team of people who are doctors who are super interested in increasing the amount of diverse physicians, diverse pharmacists, diverse dentists, diverse podiatrists, just diverse healthcare workers who are here to talk to you, answer any type of questions that you may have, and just let you know that, hey, we did it. You can do it also. So once again, guys, my name is Dr. Nee Darko. I'm one of the mentors of the Tour for Diversity. And I've been a part of Tour for Diversity for a little close to about 7 or 8 years, but it's been basically going for around 10 years. And if you're not familiar with the Tour for Diversity, it's a grassroots effort that is meant to educate, it's meant to inspire, it's meant to cultivate future underrepresented physicians, dentists, pharmacists, whatever you want to put afterwards. We're here to increase the amount of healthcare professionals and providers out there who are coming from diverse backgrounds. Now, listen, this session is for an hour, but I just want to quickly just say, listen, the reason why this session is needed is that, listen, diversifying healthcare, particularly diversifying the healthcare workforce, improves outcomes in patients who look just like you, who look just like your family members, who look like people who come from your neighborhoods, right? They may be subject to something that you may have heard of called disparities. Maybe if you live in one neighborhood, you may get a certain type of healthcare, you may get a certain type of medication, you may get a certain type of treatment option. But if you live in another neighborhood that may be well-to-do, you may get something completely different. That's called a disparity, right? There's been a lot of research, there's been a lot of evidence that shows that one of the tools, one of the weapons that we can use to stop that disparity is by having a diverse workforce, by having people from your neighborhoods, people who look like you, people who look like your family, go to medical school, go to podiatry school, go to pharmacy school. So we're here to come and cultivate and answer any questions that you may have. So look, it's really important to make sure that we keep the pipeline going, but it's also important not only to keep the pipeline going, but also to increase the amount of people who are coming through this pipeline. So that's what we're here for you. So listen, we're gonna answer any questions that you have. We only have an hour. So I really want y'all to be as interactive as possible. But if you have a bunch of questions or any type of question, put it in the chat box. And we're going to try our best to answer all of your questions. So any question that you can think of for any of us, I want you to put in the chat box. I will read it. And any one of the super docs that are on here will answer them. So before we jump right into it, let me give our panel an opportunity to introduce themselves. Let's start with Dr. Shanita. Do you want to go ahead and introduce yourself?
Yes, I'm gonna keep it super brief so we can answer all your questions. I'm Shanita Frisco. I'm a family medicine doctor in Hampton, Virginia. When I did this program, it was called SMDEP, and this program is the reason I'm a doctor. It introduced me to MAPS and SNMA, and you couldn't stop me once I figured out what those things are. Yeah, so I owe a lot to this program.
So Dr. Shanita, real quick, can you just tell us the type of patients that you see on a daily basis?
Yes. All of them. I can see children from birth to death, really. I choose to see 13 and above because that's just what I like. I could even deliver babies, but that gives me anxiety, so I choose not to do that either. So I pretty much see everything, 13 to death, chronic conditions. I do some procedures. I do acute problems. I'm pretty much the person who, if you need to see a heart doctor, you come see me, we talk about your problems. If I can't treat them or control them, I send you to a specialist. If you need to see a surgeon, I definitely can't do that. I will look at your problem. Okay, you need to see a surgeon. I will send you out to a surgeon. So I guess you can say I'm the gatekeeper, kind of, depending on what insurance you have, for medicine.
Awesome. Thank you very much. All right, Dr. Sierra, please introduce yourself. Tell us what you do.
Hi, everyone. My name is Sierra Sears. I do geriatrics and palliative care in New York City, primarily in the inpatient setting, so in the hospital.
So tell us, what kind of patients do you see? What kind of medicine? How do you practice your medicine? What is, just to explain for the for the students?
So I see old people and dying people, actually. That's what I do. So if you are somebody who is 65 and up, or somebody with a severe or terminal illness, I will see you if you get admitted to the hospital. I primarily specialize in advanced care planning, which is planning for when things in life are either not going so well, or if you're at the end of your life. And I also do symptom management. So people with severe illness, like let's say cancer, for example, they have a lot of symptoms like pain, nausea, fatigue. I get to treat that. So I specialize in making people feel better, and I love that. And during their most vulnerable times. So I love that.
As a trauma surgeon, everyone, I work directly with patients or doctors, just like Dr. Sierra, on a regular basis. I take care of some of the sickest, and oftentimes they're really old. We're talking about 70-year-olds, 80-year-olds, 90-year-olds who have severe traumatic injuries. And unfortunately, they don't recover like when they are 20, 30, and 40. So oftentimes we work together to make sure that we can do the best that we can and offer the best quality of life. So thank you for what you do, Dr. Sierra. And we also have Dr. Brandon. You're up. Tell us about who you are and what you do.
Yes, sir. Hey, what's going on, everybody? My name is Dr. Brandon Henry. I do what's called primary care sports medicine in Riverside, California.
What kind of patients, or tell us what type of what your practice is like, so people can understand specifically what you do.
Right. So primary care sports medicine is after you've done your primary training in one of the primary care specialties, whether it's pediatrics, internal medicine, family medicine, even some emergency medicine as well. And then you do a fellowship, an extra year of training in sports medicine. So for me, I primarily work at California Baptist University at the Student Health Center. Here I'm the team doc for the athletics department. And so I see athletes, I also see college students, but I treat primary care. So I can take care of colds, I can take care of strep throats, I can take care of all primary care things, but I also take care of the MSK, the musculoskeletal side for our athletes as well, meaning if they have a knee injury, I evaluate them, and if they need surgery, or if they need an MRI, I get the MRI, we go over the results, and then if they need surgery, then we send them on. If not, me and the athletic trainers take care of it and get them back going. So I like to look at it as I'm a former collegiate athlete, and I just love being able to see athletes do their thing on their respective fields. And we like to get them back as quickly and as safely as possible to doing what they do.
I got a specific question for you, Dr. Brandon, but real quick, everyone, make sure that when you're asking your question, we love questions and we love to answer them. Make sure you use the Q&A button to ask the questions as opposed to just the chat. I should have been clearer on that. Just make sure you click the Q&A button so that when you ask your questions, we know exactly where to look. But these are great questions so far. Dr. Brandon, can you tell people where you were this summer, please?
So this summer I was, so I'm one of the newest team physicians for USA men's water polo. I was in Montenegro with the Olympic team as we were preparing for the games, and yeah, I got to be with them for 2 weeks and just was a part of their training, getting them ready to compete in the Olympics. And so it was a lot of fun, great experience. Yeah, it was dope.
So we got a lot of questions here, but before we jump into those questions, I want to ask y'all each the same question. I want you all to answer it as quickly as possible. But listen, why is it important for y'all? Why is it important for y'all to diversify the field of medicine? It's a jump ball. Any one of y'all can jump on that.
All right, well, I'm unmuted, so I guess I'll just jump right in. I know I recently just did a journal club with some master students about cultural competency, diversity, equity, inclusion things. And so for me, I think it's super important because if you look at the field of, and I'm gonna speak about my particular field, but if you look at athletics is very diverse, right? Athletics, you have people from all different colors, all different ethnic backgrounds, whatever. And so the ability to be able to identify with the athlete makes a huge difference in their ability to accept either the diagnosis or accept the treatment plan. And get them back sooner, right? I think it makes a huge difference when we can see each other eye to eye and we can have a conversation with each other and we can understand each other, right? Like they know if they know because I played collegiate athletics, right, that I have a different understanding. They also know that I come from a certain background and certain communities that, hey, I understand a lot of other different things. So we can talk and see eye to eye, and they will accept me as a team doc much, much better. And they'll also buy into our program of what we're trying to do to get them back quicker. So yeah, that's one
Love
thing.
that answer. Love it. Who else wants to jump in on this?
So for me, we know that people of color, especially Black people, have a mistrust in the medical system. And there have been several studies that show that Black people are high utilizers of medical care. At the end of life, they're more likely to pursue things that are very invasive and don't necessarily improve medical outcomes. And so I think that it's important to diversify this field of medicine, because think about the people who are taking care of your grandparents and the kind of care that they want to receive. So much like Dr. Henry, when these old people see me walking in the room, they're in the hospital, they're sick, they know that somebody cares about them, somebody is listening to them, somebody is going to take their pain seriously and treat it appropriately. And that's what I think about.
Hey, Doc. Dr. Shawnita, you up?
Yeah, so I really don't have much to add. I can just tell you a story. We interviewed somebody from my clinic, and my office manager is all about healthcare disparities. And she asked them a question about it. And the doctor said, when patients don't understand me, I think they're illiterate. That was her response. So we need you, so those people don't work for my clinic and all my patients are mostly look like me. You shouldn't think someone's illiterate because they didn't understand you. Maybe you should explain something differently in a way that they can understand. You can explain things better, way people can understand, if you understand where they come from. So I want you to become a doctor, dentist, podiatrist, whatever, to help fix that.
Okay, excellent answers. So listen, we got a question so far. This is the first question that came through, and this is something that I think in some form or fashion, I think we all can identify with, which is at times discouraging pre-health advisors, or what we perceive to be discouraging pre-health advisors. So this question is, as a minority student, it is really hard to stay motivated, especially with discouraging pre-health advisors. Do you have any advice to combat this? This is a jump ball. Who wants to jump at this?
Me.
Dr. Shawnita, go ahead.
This annoys me. Ignore them. Are they a doctor?
I like that.
Are they? No. Did they go to medical school? Most likely not. Go find somebody who went to medical school and ask them. Ignore them. That's all.
I like that. Dr. Brandon.
I'm gonna jump in. Love Dr. Frisco's answer. What I'm gonna add to that is also play the other side of it, meaning take something from what they said to you, right? Like I don't agree with a lot of things that people say, but I've learned that I've been able to, I might try to find one particular thing that they said, and I might use that. Now use it however you want to. For me, when somebody tells me no, I'm hard-headed, so I'm gonna use it as motivation. I'm gonna use it as fire, right? So it's just going to encourage me to keep going, right? So yeah, find somebody else that's going to feed your spirit the way you need to be fed, but also learn how, what I'm saying, you respond to things. And again, some of us like when somebody says no. And if you need that, then hey, use it to your advantage. Flip the script.
I love it. I love it. I love it. Okay, another question we have is the whole topic of taking a gap year. Okay, particularly that of becoming a non-traditional student. So here's a question from Chloe. She says, what is some advice that you would give to a senior that is planning on taking a gap year to complete the rest of their prerequisites? I took a gap year. I don't know if any of y'all did or did a post-bac, but anybody want to jump on this?
Yes, I can. I took a gap year because I failed my MCAT the first time. So I couldn't go to medical school right after.
See, I like that because people don't talk about these things. They don't share these experiences. Like it happens, right?
Yeah.
And you have to take a year off and get stronger. It's okay. but I'm sorry, not to cut you off.
That's okay. That's
Yeah.
okay. So I retook my MCAT my senior year of college. And so I did the tour for diversity. I was a substitute teacher and I worked at Banana Republic. So
What? Say
I
that
didn't do
again. You did tour for diversity. What else?
Substitute teacher and I worked at Banana Republic.
Wow. You still got that discount?
Nah, man, I wish. I got a lot of clothes in though. And I can fold shirts really well.
Okay. So what did you do during that year off, or how did you get your mind right for that year or 2 years, how much time you took off during that gap period of time?
So for me, it was kind of just interviewing in that year. It was really my senior, because I failed my MCAT my junior year of undergrad. And so I had to retake it my senior year and interview during my gap year. So and then I went into medical school right after. So I pretty much networked. For me, sometimes it's not about what you know, it can also be about who you know. So the who's helped me get into medical school. SNMA helped me get into medical school. So I continued to network and do things that I loved. I loved helping other people get into medical school because I didn't have access to the information. My parents, I was the first doctor in my family. So I loved finding ways to gather all the information that I didn't know about and give it to other people. And the Tour for University was a perfect avenue for me to do that at the time. So I just did things that I liked, really.
Okay. Anybody else want to take a shot at this?
Yeah, so I actually had 2 years off in between undergrad and med school, and that was because of undergrad took me 7 years to do. I got kicked out of school twice for
Say
my
that again.
grade.
How long did undergrad take you to complete?
7 years.
Okay.
I got kicked out of school twice because of my grades. I took my MCAT 3 times. I applied to medical school once before and a master's of public health program. So ultimately what I ended up doing, because my GPA was trash, and when I say trash, I mean it was like a 2.5, I think. But I had to do a post-bac, so I did the UC Davis post-bac program. And then
quickly tell people what's a post-bac program.
Oh, yes. So a post-bac program, there's different types. But a postdoc program is a certain number of years after your undergraduate education, to where you will take additional courses either to raise your GPA in the biological sciences, or they have a career change. Whereas if you were a different major, meaning you were like an engineer major or a poli-sci major, something like that, and you didn't take any science courses, you take a post-bac program that will have you take all of the prereqs. Most of these programs also have MCAT prep tied in to their postbacks, and they also typically help you with, like your applications and everything. So I had a 1-year postbac that was just for trying to raise my GPA. And then after that, I worked in physical therapy, and then I started in medical school.
You are literally the epitome, the picture of persistence. You don't give up.
No, you
don't give up.
9 years from high school until I started med school.
I hope you all pay attention to that story, because that is something that I think you all can keep in the back of your minds when you hear someone telling you that you can't do it, or it's impossible to do this unless you get like the highest grades or the best MCAT scores. Like, it's all about working hard. It's about networking. It's about being involved in these type of organizations. It's ultimately not giving up. Okay. Let's move on to the next question. Dr. Sears, let's see if you can answer this. What's the best advice for gaining experience as an undergrad student that will increase your chance of getting into medical school? What say you?
Ooh, that's a good question.
Mm-hmm.
I'm definitely going to need assistance, because I think the most common question that we get is how to shadow and how to approach a doctor about shadowing.
People get nervous about this stuff.
People do get nervous about this stuff. I was lucky enough that my cousin worked in the emergency department, so she scared that right out of me.
Your cousin's a physician?
She is.
Okay,
she was
awesome.
a physician in the Army, and she worked in the emergency department, so she scared me right out of that specialty. I don't really know the answer to this now that I think about it, like outside of just asking.
Well, I think shadowing is really important. right? So everybody who's watching, shadowing is exactly what Dr. Sierra is talking about, right? She got an experience where she got to maybe ask some questions, spend some time with her cousin in emergency medicine, and just found out that it wasn't for her. So when she says scared it out of her, that means that she spent the time, she saw the lifestyle, she saw, what the daily schedule is like, and realized that it wasn't for her. And that's okay. Right? That's okay. So I think that is a really good piece of advice. Does anybody else want to offer any other type of advice for gaining experience to increase your chance of getting into medical school? Any other experiences?
Experience. Okay. All right. I'll say what helped me was being a part of SNMA.
What is SNMA?
SNMA is the Student National Medical Association, which is the largest organization for I like to say Black medical students, but it is for students of color that are in medical school. There's usually a chapter at every single medical school, typically. And so for me, I was introduced to the Student National Medical Association in 2004 at the national conference in New Orleans. And for me, going to that conference was what changed and flipped everything, because I got experience from that simply because I then met medical students that were in the region and I made contacts with them. They would then kind of, in a sense, take me under their wing, right? And I could talk to them about med school. I could, shadow them if I wanted to, a day in a life kind of things. So being a part of the SNMA really opened up the doors for me that way.
Thank you for sharing. Dr. Sierra, you want to jump in and say something again?
Yes, I think actually now, being able to think about it and looking back on my experience as a pre-medical student, medical student, and somebody who now talks to medical students and pre-med students, being a well-rounded student who has interests outside of medicine also makes you easier to talk to and makes you likable. So a large part of my interviews for medical school were actually talking about my other hobbies, like reading books, writing at the time. Like Dr. Frisco, I had like 3 retail jobs, and
you still got those discounts?
We don't want to shop there anymore. Well, I used to work at Macy's in the shoe department, so never mind. But those experiences outside of school and outside of my aspirations to be a doctor are what made me seem more like a person and somebody that people want to work with in the future. So I would encourage you guys to be interesting and have hobbies and still do the things that make you happy so that you can still be passionate about those.
Mm-hmm. And even jobs set you apart. In residency, somebody commented on my first job working at McDonald's. They're like, "Oh, you had a job?" Duh, I had a job. I'm in residency. I'm like, I don't know how old was it. Was that like 22 or something like that? I can't remember. But yes, I had a job. They're like, well, I like people who've had jobs because they know how to be responsible. So having a job is a plus. I also have to agree with Brandon, SNMA and MAPS. You definitely get involved with that. You can hold leadership positions and you can find great mentors through those organizations.
All right. How many people who are watching right now, how many people like free stuff? If you like something free, put in the chat bar, I like free. I like free. Just say me. Please type it in. Who wants free stuff? All right. I don't see, nobody's going to get free stuff if you don't put in the chat. Go ahead. Someone type something in. Okay, cool. So listen, I know you all have been wanting to get on your cell phones. We got a free raffle that's going on for some books that are going to help you all. I want you guys to get on Instagram right now. I want you to follow the handle Tour for Diversity, TOUR, the number 4, Diversity, DIVERSITY. I want you to follow it right now. I don't see the following count going up. I'm not seeing the follow. I'm refreshing. The following count it is going up. I want you guys to follow it. And I want you to see the advertisement, the image for this webinar that's going on right now. I want you to leave a comment, and then I want you to tag 3 friends, and you'll be immediately entered into the raffle. Let's go, guys. I'm refreshing. There you go. 17. There you go. All right. Awesome. Someone asked, what is Instagram? Come on, yo. You lost already. All right, let's jump into.
Keep that same energy. That's how you stay successful. What is Instagram?
Good point.
All right, let's go into a question about how about MCAT, guys. So let's do, let's do something about MCAT tips. Someone asked, excuse me, MCAT tips and how to create a schedule to study for it. Also, what extracurriculars are the best for med school application? So let's focus on the first part. MCAT, big deal, right? As well as any of the standardized tests that you have to take to get into the respective schools, pharmacy, podiatry, dentistry. Any tips that you guys have off the top of your head that helped you to be a little bit more successful?
So the MCAT told me I was illiterate the first time I took it, which is not true. I knew I wasn't illiterate. They just had boring reading sections. So what I did is I got the newspaper and I read the political section every day, so that I can stay focused and pay attention. So whatever I didn't find interesting in the newspaper, I read it. So that's one tip I have.
And real quick, there's a lot of people leaving messages. Hurry up, guys. Leave messages. Leave messages. Come on, leave the comments and tag 3 people. Come on now. Come on now. I'm refreshing. Go ahead, Dr. Brandon.
No, I was gonna say, I think what Shanita just said is huge, because that's, again, the MCAT told me I was illiterate as well. So when I took it, it was out of 45. It was 15 on each section. The first 2 times that I took the MCAT, I got a 2 out of 15 twice. And I walked out of there thinking to myself, a 2, like, I felt like I couldn't even write my name. I thought I did something wrong. There's no way you should get a 2 twice, right? So what I had to do on the 3rd time was I took the economist. And because, again, the MCAT, the verbal reason section to me was just, it made no sense to me. But I took the economist and I read 2 to 3 articles in the Economist every day, just to work on my verbal reasoning score. And it made it jump a pretty good amount. So I agree with Dr. Frisco that you got to challenge yourself to the things that you're not good at.
Okay. I would definitely say the key thing is training your brain. That was a big tip for me, which is training my mind to take the test, not to really study, but to take the test. And that meant doing tests over and over and over again. And it sounds really weird because we're normally taught we need to study first before you take a test. But training yourself to be like, I'm going to study and understand through taking tests and getting answers wrong, and then quickly knowing the answers and moving on. Because ultimately, it's not about how much knowledge you know or how much you can retain. It's really how well you do on the test. Okay. So that was one big thing, everyone, that I want y'all to take. This is some all great advice, but my opinion also is understanding and training your brain, because it's a grueling test. All right. So here is a question about, this one is straight to you, Dr. Brandon. What did you major in in your undergraduate? Your field is pretty similar to what I want to go into, and I am interested in knowing if I am on the right path.
Nice. What I majored in was biological sciences. Now, if I could do it all over again, I would have stayed in my original choice when I first started undergrad, which was kinesiology. Kinesiology for me was something that I truly enjoyed, the study of movement, and it makes a lot of sense with what I do with being a sports medicine doc. So I tell a lot of people that one thing I could have done too was do some athletic training stuff in undergrad. It would have been a lot of fun to work with the sports teams, and then you get a little bit more experience, or a little bit more experience into the sports medicine world. So
awesome. Let's see. We got a lot of questions. How about this? Let's do something real easy. How can we find a mentor? Who wants that one?
Go to Tour for Diversity.
Yeah, that the same thing we would keep saying, like estimator maps. So yeah.
So hey, whoever asked that question, listen, all of our contact information, if you follow Tour for Diversity, all of the ways in which you can get in contact with us is all, attached to that page, whether it's on Instagram, whether it's on Twitter, or you can go to the website and reach out to us, and we're more than happy to connect.
Sierra, did you have something for it?
No, I was just flexing in my little little shirt.
All right. Well,
I did put the SNMA website on somebody's question. It's just snma.org. And that will also give you more information about maps and how to connect with the organizations in your area.
And so, and honestly, MAPS and SNMA is another great way to find mentors outside of the Tour for Diversity. I think another thing that you can do is at your school, right, is just find somebody there, right, that you may have a connection with, because everybody does know somebody to a certain degree, right? So you find somebody that you do have a good relationship with, and just explain what it is that you want to do, and try to make a connection that way. I'm also a big fan of going after what it is that you want. So I will email somebody constantly. So I'll go onto a website of some sort. If there's a school that I want to go to, I'll email there and try to see if I can get some answers. Maybe I can get plugged with somebody that way to find a mentor. So, but I think it's really just a matter of you just have to keep trying, right? It's almost like you almost like, it's like mentor dating to a certain degree, right? You will, try to get different mentors, and you get to know them and see if they work for you. And if they don't, it's perfectly fine. You move on and keep trying. So
yeah, and there are some good pre-health advisors out there. I know we said, ignore them if they say the wrong things, but there are some good ones out there and we appreciate them. So you can also go to them. If you have a good relationship, they might be able to direct you in the right location. I'm sure they are, to help you get a mentor to shadow.
And we also
volunteering.
Yeah, we said ignore the ones who discourage you, the
Yes.
ones who tell you you're not going to be a doctor, because I had both. I had somebody who told me you'll never get into another medical school, and I got into everyone that I applied to. And I had one that said, if you don't ever go in that office again, it'll be too soon. And I still communicate with her to this day, and I've been a doctor for 6 years. So pre-health advisors are out there. They and we love them when they do the right things.
Go ahead, Dr. Brandon, real quick.
I was just gonna say, we have two phenomenal pre-health advisors that are part of the Tour for Diversity as well, and Miss Janae, and then Mr. Francisco. So again, their contact information is on the website. So again, look up to see, they're definitely sure they can answer any kind of questions you may have.
So once again, everyone, this is a great opportunity to connect with people who have made it. And not only have we made it, we want to help y'all out. So we are an open book or open door. We have an open door policy. You can reach out to us and connect with us. And if you want to see all that's encompassed within Tour for Diversity, go to our website, tourfordiversity. It's .org, right? .org. All right. Here's a really interesting question. It is from Miss Miranda, or Dr. Miranda, excuse me. I am the faculty advisor for MAPS at the FSU College of Medicine. Looking back, what do you wish you learned prior to entering the field of medicine? I would like to empower my students as much as possible.
I wish I took a gap year, not by choice. If I knew how hard medical school would be and how time consuming it was, I would have just took one and lived life and traveled. So if I could go back, I'd just say, hey, take a gap year and enjoy life before you are spending the next 4-7+ years, if you go into some type of specialty, in school looking at a book.
Okay. All right. Interesting perspective. Dr. Sierra, jump in on this.
Yeah, I agree with that. I mean, I just had my first time off longer than 2 weeks since the 11th grade, and I just really agree with that.
Wow.
Wow. So I would say definitely take some time and get to know yourself and travel, and just always appreciate the things that made you appreciate the things that made you want to go into medicine in the first place. I mean, there was a question about burnout and how you deal with that. And I'll be honest with y'all, I was really suffering from burnout, especially with my specialty in the pandemic. Like, I was around dying people just like all day, like young people that were dying just out of nowhere for months in New York City. And I had to go back and read my personal statement as to why I applied to medical school, why I applied to residency, why I applied to this fellowship, and really remind myself, like, who is that little 17-year-old girl who wants to go to medical school? Like, and I was like, oh, you're not the same person anymore. And really had to like do some deep diving and figure out, like, yeah, you're supposed to be here. You wanted to do this and you're here for a reason. And it was actually very, very therapeutic. So don't forget yourself in the process. That's all, because it is a grind and you'll be like just one day at a time, but you are a person.
Yeah, I think one thing that we've learned after this past year is that, there are some people or some folks or professions where, when it's time to run away from an issue, that's what they do, which is fine. But there are other professions that just can't do that. And medicine, anybody in the healthcare profession, we're part of that field workforce, and we can't run away. We have to go towards problems. And as a result, it affects us, but we're humans, So thank you for sharing that, Dr. Sierra. Anybody else want to answer this?
Yep. Two things. One, learn to be okay with failure.
Yes. Yes, that's a good one. Mhm.
Failure is inevitable. And so you just have to learn how to deal with it and learn how to move on from it. The second thing I'm going to say is that when picking a medical school, all right, I chose, and so did the wonderful and the most beautiful Dr. Sierra over here. We chose the best medical school in the country, which is a part of the
In the
best.
world, in the world.
You're in the world. I'm sorry. Yes, you are correct. We chose the illustrious Howard University for our medical school. And I tell people all the time, I say, those 4 years were for the best years of my life. And realistically, because of how much fun I had in medical school, I would be okay with doing medical school again simply because of how much fun I had. This is just me personally.
Would you extend it out like undergrad?
I didn't say
No.
extend it out. Right? I didn't. That's we're talking about like break it up, right? But no, I think a lot of times in choosing medical schools, again, I'm not one that chose a medical school based on ranking or anything like that, right? I chose a medical school that was based on the fits for me and that what I wanted, and what made the most sense for me. So I think it's good to choose a medical school that you can choose a place where you can be in for 4 years and thrive even when things are at the ugliest and at the worst for you.
Yeah.
So
Yeah, I would have to say choose a medical school either where you're close to family or where you have that family atmosphere. I knew a lot of people at Howard, and
Region
I
6.
would have to say, yeah, it's a great medical school. I don't like my medical school. Did I enjoy my time? Absolutely not. Did I get a good education? Am I a good doctor? Yes. Would I repeat a single second of it? Absolutely not. Would I have felt differently if I went to Howard? Most likely. But my Howard mentors said I should come to this one because I went to an HBCU for undergrad. So yes.
Okay.
Fair enough.
All right.
Okay. All right.
I think for me, my answer would be I did not have to major in biology, biochemistry, chemistry, physics, physical chemistry, any of those things that are related to science that I thought was going to impress an admissions committee.
Right.
I did not have to major in that. I could have majored in something that I was really interested, and then taken something that's called prerequisite courses to get into medical school, because that, I think, looking back for me, would have gave me more of a broader experience in college, and then really focus down and get really niche once I got into medical school. That's one piece of advice.
And Dr. Darko, the interesting thing about that too is that a lot of times people will take biology or do certain things just to check a box.
Yeah.
And it's interesting being on this side now when I'm dealing with like interviews or like admissions things for fellowships and such, you can tell when people are doing something just to check a box. And it sticks out like a sore thumb. So I think that's a great point, right? Is that when you think about your major, don't do it just to check a box. Do it because it's something you actually enjoy, so that you can be just that much more successful in it.
Let's jump into your intern year. There's a question here about med Twitter and intern year. So let's dispel some myths, okay? So someone asked, I've read a lot of things on hashtag med Twitter about interns and residents struggling to find programs that aren't abusive to new graduates who are training. Is this true in any of your experiences? I'll leave my experience for last. Y'all jump in on this.
I think it also depends on like the specialty probably. So family medicine is super chill.
Yeah.
There's not like a whole bunch of pimping yet. And for my residency, intern year wasn't the bad year. It was second year where I was stuck in the hospital all the time, 80 hours all the time, just lived there. So it's definitely specialty specific. Family medicine, you don't have to worry about that. So I'll let someone else comment.
Yeah, I did internal medicine for my residency. And there was not a lot of that whole like malignancy, like excessive pimping. Like there was none of that. They were really there to make sure that you learned all the information, because it is a lot, and to make sure that you did not get in a car accident on the way home. So, I mean, I do think that it's specialty dependent, and I think that that's unfortunate. And I also think that there are a lot of people who are trying to address that and start changing the culture around it. But I can't speak to that because I'm not a surgeon.
Well, wait, hold on. Actually, one of the toughest specialties, I think, is what this person is going to talk about next. Go ahead, Dr. Brandon. Pediatrics is one of the toughest specialties.
That's what I was
Yeah,
going to say.
They're cutthroat, yes.
Makes per kigs for everything.
Yeah, I did my residency in pediatrics, and I'm trying to figure out how I'd want to answer this, because I didn't have a great experience in residency. Matter of fact, I really disliked the 3 years. I battled with depression for a long period of time, especially during my intern year. My place was a very malignant place in a lot of different ways, and it's pediatrics, right? It wasn't really something that I thought was going to happen, but it surely happened. So, I think that it's program dependent, even with the different specialties. But I also think that when you go on your interviews, that's when you try to learn those different things and kind of weed people out, because you're going to have people in your program who are going to be they like to pimp more than anybody else, right? They like to ask all the hard questions, whatever, right? It's going to happen. But I should have said pimp, like ask the questions, right? It was kind of anyways, I'm spinning. It is what it is. I just think it's program dependent. And, but again, my place was very malignant.
So I did general surgery, which is notorious for having a very tough residency. I think looking back, the most important thing, guys, that I have to say is whether you go into pediatrics or you go into family medicine, or you go into internal medicine, or you go into general surgery, or you go into ER, there's going to be great programs. There's going to be busy programs. There's going to be programs that are okay. Sometimes they are just all jazz hands when you go on your interview. So you never know. And then they pull the okey doke on you and things change. You just never know. The most important thing is to keep your eyes on the prize. And also the biggest thing that you can do to change a program is to never let the program change you. Right? If you can maintain who you are, if you can maintain all the things that you enjoy doing in life, being with family, learning not to let it affect you as much as possible, and reconnecting, that's the most important thing that I would give to anybody who is worried about the experience that you may have in a tough residency. Listen, let's jump into recommendations, or not even recommendations, but how to connect with someone that you want to shadow with them. Particularly, I'd like you guys to answer from a perspective of, what if you were trying to shadow and you already had a job? How do you shadow if you come from a certain socioeconomic background, and maybe you have to work and you have to do something part-time? Like, talk to us about how you were able to reach out to your mentors or shadow people so you can get letters of references from.
Well, you can email them. You can find some different doctors and email them. I know the ER is open 7 days a week, 24 hours a day. So I don't know if people were able to shadow in the ER, but that is an option. I know I've had patients who expressed an interest in medicine, and I offer for them to come and shadow me during their appointment. I even go to my office manager and say, hey, I need this person to shadow. And my office manager says, okay, that's fine. They just can't be your patient anymore. Okay, fine, great. I can make do with that. So I think it's just, taking the initiative and going out there and just really working hard to find something that works for your schedule. If you work part-time, well, the other part of the time you can be putting in that work to become a doctor, a dentist, or something. You might have to put in extra hours, but trust 100% it's going to pay off in the end.
Okay. Anybody else want to jump at this?
I was going to say, because I think Sierra is answering questions. I agree with the emergency department was where I just went over there one day and walked in and was like, hey, I'm a pre-med student and I want to go to med school, and I want to see if I can start shadowing somebody. And then they gave me one of the little shadowing jobs. They're not jobs, but the volunteer things. And that's when I just started shadowing any and everybody that was in there. Then I just started asking questions. I really have no problems. Like, I've never met a stranger, so I have no problems asking somebody, hey, can I shadow? Hey, what you got going over there?
Mhm.
So I think, but then also use things that you're interested in, right? So for me, being an athlete, right, when I was injured, I would always ask my athletic trainer about things, and that can kind of go from there. So I think it's a matter of finding what you're interested in. Then once you can think of something that you're interested in, it doesn't have to be exact, right? But you find something you're interested in, and then go from there.
Mhm. And I see we're focusing like a lot on shadowing. I didn't do a lot of shadowing. I did my shadowing at the SMTEP program. It's SHPEEP now. And I don't know if they still offer that, but that's where I got my shadowing in. And I volunteered. I didn't do a lot of shadowing. I found out what type of doctor I wanted to be when I was in med school. I wanted to be a pediatrician. I did a family medicine rotation. I loved it. I did a pediatrician rotation. I hated it.
That's
Hey,
simple.
this is an opportunity. We got this next question or this next comment. I think there's an opportunity to encourage someone. It's an opportunity, excuse me, to bring someone through the pipeline. So this person says, do you have advice for someone who is struggling in science courses? I think we've all been there. I struggle with test taking skills and I am losing confidence in myself because of the MCAT. Somebody help this person, please.
All right. So I'm gonna go ahead and dive right on in here.
Come on now,
All right.
get in this.
So
Do this
let's
first so they know that you're ready to do work.
Oh, yeah. I know that. That's why, if you saw me, that's why I took the glasses off, wiped my face off, right? Put them
Get
back
ready.
on. That was what let you know I was ready for it.
All right, good.
All right. So here's the thing. I think that for all of us, we all hit a moment where we're up against the wall because we're challenged and we're not sure what to do. I think in that very moment is when you have to take a step back and you have to reevaluate. You have to reset the mechanism. You have to just take a deep breath. All right. So I was a guy that, again, I was trash at science, right? I had taken general chemistry 3 times. I think I took physics 3 times. I really had no clue of what I was doing. And honestly, it took a come to Jesus moment for me before things actually started coming together. And when I say that, I mean, I went to church one day and I said, God, I have no clue what I'm doing. But I know that I want to do this, but I don't know what I'm doing. Like, I've been in school for 5 years now, and I haven't taken a single, really any kind of science class. Like, what do I do here? And he caused me, I had to make some major sacrifices, had to move out on my own, right? I had to start attaching myself to people that maybe I wouldn't have necessarily talked to, but I saw that they was balling in these science classes. So I was like, okay, let me attach myself to them, right? Let me become friends with people who have things in line. And then all of a sudden it started being a thing where I stopped going to parties because I had people that were helping me be accountable, and they would pull me and say, let's go to the library. Right. So I was always in the library because somebody was on my head, like, nope, let's go. Even when I didn't want to, it was like, no, come on, we doing this. Right. And then I had to learn how I needed to study. I knew that I needed a whiteboard, and I knew I needed different color markers because I could put things on this big whiteboard. But once I figured that out, I just went where the whiteboard was and I started doing all of that. I knew I needed music, so I studied to music, right? I started doing all the different things that I knew that made me successful. And then it just started rolling. All you need is one good time to see one good grade. And I promise you, when you see that one good grade pop up, it's like it's those natural endorphins on the smart side that makes you go, you know what, I can actually do this. Right. Like when I saw an A, like an actual A, like not one that I had just written, right? But one that was actually like mine attached to my name, changed the game for me because it made me feel like I actually can do this. And then it just increased my grind. It changed my grind. And then all of a sudden it was like, now you start getting into a season of winning, right? When you think of professional sports, or you think of sports in general, right? They talk about getting on a winning streak. And when you get hot at the right time. And I think in this science game, we want to start off hot at the beginning. Not everybody starts off hot at the beginning. You just need to get hot at the right time. And getting hot at that right time is when it's your time to be able to, to start that process. So you got to keep your head up. You got to keep grinding and recognize that failing is going to happen, right? These sciences, they are what they are, but they can't defeat you. You know what I'm saying? And if you lose, okay. There's only a few teams that have had a perfect season, right? I translate everything into sports. There's only a few teams that have had perfect seasons, right? People, you're gonna lose some games, but the goal is to win the whole thing, right? The goal is to win the marathon. So keep your head up, keep pushing. Don't worry about one mistake, two mistakes, shoot, 3, 4 mistakes, right? Pick yourself up every single time and keep pushing. If it's what you want to do, keep digging, keep scratching, keep clawing, and do what you got to do to get to that finish line.
I love it. Look, we got 5 minutes left. Let me throw up this one question, and then at the end, we want to send everybody off on a high note. But let me ask this one question: is it true that you will have no life in medical school, or that your mental health will decline in medical school? Thoughts?
No, 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 no. I found my husband in medical school on Match.com.
Oh, what a flex.
So I believe in work-life balance, but no, by no means was I the top performing medical student either. So I studied, but during the week and on my weekends was time with my boyfriend. So yes, you can have a life.
I was too turned up in medical school. I'm not gonna lie to y'all, okay? Because I was at Howard University. I turned 21 2 months into medical school. The whole school came to my birthday party. It was too lit. It was too lit. Okay, you need to pull it back to the other side. Okay, like, is it true that your mental health will decline? It can. You know, I think that we're in an age where we're more transparent about all of our struggles with mental health, with depression, with anxiety in particular, and you can develop those things. The important thing is to notice that, to seek help, and to not let it get the best of you. But again, I was too turned up.
Well, and I think you also got to have your folks around you, right? You got to have your circle, and because look, there's gonna be times you go fail an exam, you might fail one of the step exams, and your mental health it'll mess with you, right? Because there's plenty of times where I think I failed. Like, I had a whole backup plan that if med school didn't go well, I was just gonna stay in DC and work at Popeyes for the rest of the 4 years, and in that way, everybody knew, I could just ride the time out, right?
Dark, spicy,
And still be turned up.
Spicy or regular?
I'm spicy at times, but then I like the regular too. So it just depends on which one. But yeah. So, and then like when I failed my neuro exams, I was like, all right, well, that's it. Let me just go ahead and contact.
Let me tell you.
Listen,
I failed those tests too, and Brandon was like, "Oh, you'll be all right. You'll be back. You'll be all right."
Hey,
and I was fine. I
but
failed
like,
so many tests.
And my mentor was messing with me, but I had such a tight group around me that it was just like they would always tell me, "You got the rest of the night and maybe half of tomorrow to grieve that loss."
Yeah.
And then after that, we right back up on the horse.
And this just shows that.
MD.
Go ahead.
Yeah, this just shows that people from Howard talk together, because I think Nisha told me that exact same thing that Brandon told me when I failed my MCAT. It was like, okay, you failed it. Have you had time to cry about it? Okay, what's the plan? Let's move on. Because the next thing is coming. And I did say, I enjoyed medical, like that, my boyfriend in medical school, but there were times where I struggled. I did fail a test. I wanted to quit. And I called an SMA mentor. He actually went to Johns Hopkins at that time. He was like, everybody's wanting to quit. Everybody feels that way at least once during medical school. Yep. So I'm sitting here crying on the ground, like I'm quitting, calling my parents. And my parents like, no, you're not. I'm Dr. Frisco now.
Let's send people off on a high note. Okay. Because I think sometimes we focus a little bit too much on the, the disadvantages that we face as URMs, underrepresented minorities. But let's talk about the privilege, the advantage that we have, right? Tell me about the privilege, the advantage that you gained as being a URM student, a URM physician. How has it influenced you into who you are today? Send these people off on a high note. Let's do this.
The community. By being a URM student, you have a community that will support you through it all. You can call them up and they will help you through whatever struggle you're getting through. It's the community that comes with being it. In my residency, I can't believe I'm saying this, my husband, he would sometimes say the ethnic group, because we had all the minorities in the residency. We were all friends. And it's the community that we had. And that is how I got through residency.
Anybody else want to jump on this?
No, I agree. I think that being a underrepresented minority in medicine is just lit.
URM.
Like, yeah, I'm URM. You know, nobody assumes that I'm the attending when I walk in the room, so they get to say all their wild stuff, and then I get to say, "Well, you got me." So, and then get to see them, you know, transition from not maybe not trusting me as their physician to being the only one that they'll talk to. So I just think it's fun, you know, to challenge people's stereotypes and to overcome all of these challenges that are presented. It's just lit.
And I think an advantage is we get to do this, right? Like
Yeah.
we get to do this exact thing, right? We've been doing this for the past, you know what I mean, 8 years, 7, however long, at 10 years, you know, but again, we get to do this where we get to speak to students who look like us, talk like us, come from backgrounds like us. And we get to encourage, right? We get to uplift, we get to tell somebody our story, and we get to change lives. Like, and we get to change lives on almost a daily basis with doing these kind of things. And for me, I think that that's one of the things that I love is the fact that I can go to a high school and talk to some young athletes of color and say, hey, listen, sports ain't the only thing you have to do, right? You can be whatever it is that you want to do, right? I can talk to a collegiate athlete and say, hey, okay, you can aspire to be in the pros, but guess what? There's a lot of other ways you can become a professional. You know what I'm saying? So we get to change lives, and it's fun. We get to have fun doing it too.
Listen, this is what I'm talking about. This is a great session. Listen, we need more people who want free stuff. We need y'all to sign up and follow Tour for Diversity. Remember, that's TOUR, the number 4, and then diversity. Remember, for that free raffle. Okay. And not only do you follow Tour for Diversity, we also need you to comment on that post and tag 3 of your friends. It looks like time is up. But listen, this is not the last time that you'll be in touch with us. If you reach out to us on Instagram, if you reach out to us on Twitter using these same accounts, come to the website. We always have an open door policy. There's always someone who probably had an experience very similar to you, who's going through what you're going through, but openly and as a group, we all want to see you all, you know, with us here. So just want to say congratulations to you all for doing this program. Keep up the great work. And I'm going to hand it back to Tony. Are you there?
Yes, I'm here. And, you know, thank you so much, each and every one of you. You've pretty much given insight into what it means to be an URM and how to really leverage, you know, your experiences into what you become, and which is a practicing physician. So thank you so much for sharing those experiences. And I'm sure you've motivated and inspired others to ultimately pursue their dream. What I did do is I dropped your link tree in the chat. So if anyone's struggling to find any of the social media channels, if they want to follow you, I've dropped that in the chat. I've also dropped our link tree in the chat. So if you want to register for any of our upcoming webinars, please feel free. And I think we're good to go. Unless you want to have any other parting words, I think we're good to close this out, and have a good night, everyone.
Bye, everyone.
Bye. Thank you.